Masturbation. What are the benefits and areas to stimulate? Less and less taboo. Masturbation or onanism is practiced by women and men. Characterized by self-stimulation of her own genitals with her hands or a sex toy, she participates in sexual fulfillment. Frequency, method. We guide you. If masturbation is a normal practice, its frequency is extremely variable according to people, periods of life, but also people's libido. Some men and women masturbate every day, some more occasionally, and some never. It is therefore impossible to obtain figures concerning any weekly frequency of this sexual practice. Note however that a teenager can masturbate several times a day, without this having any negative impact on his health. Quite simply because it is during this period that bodies change. Benefits of masturbation. In addition to immediate pleasure, masturbation causes well-being and great relaxation in the minutes following orgasm. Because by masturbating, the person produces endorphins, which are happiness hormones secreted by the brain. Coupled with the muscle relaxation inherent in orgasm, they cause that very soothing feeling that you get after an orgasm. Moreover, masturbation can act as an analgesic thanks to the production of these hormones of happiness. Endorphins, by reducing all stress and nervousness, are also beneficial for sleep. Masturbating and orgasming before sleeping can be an excellent sleep aid. From an educational point of view, this activity also has a beneficial effect because it allows you to get to know your own body better and to better understand the mechanism of excitation. In men, masturbation can also improve sexual performance by training them to control their arousal. By practicing, they indeed learn to control their breath, which can allow them to prolong desire and erection. Not to mention that masturbation can be a rehabilitation tool for erectile dysfunction or premature ejaculation, continues Isabel Braun-Lestrade. Female erogenous zones to be stimulated. An erogenous zone is an area that is very sensitive to caresses thanks to its many sensory sensors. The whole body is functionally erogenous. The more or less receptive zones are a matter of the individual. In women, the clitoris is one of the most sensitive erogenous zones, if not the most sensitive, assures Isabel Braun-Lestrade, psychologist and clinical sexologist, vice president of the National Union of Clinical Sexologists. Regardless of their size, breasts including nipples are also very erogenous. The fondling of the breasts leads to a hardening of the nipples which is very pleasant for the majority of women. But other areas which do not have a priori a sexual character can also be erogenous, such as the skin of the armpits, very thin and sensitive to caresses, but also the lips, the nape of the neck, the inside of the hands, the lobe of the ears, stomach, buttocks, hollow of the knee, thighs, ankles, feet and toes. Tickling the soles of the feet or sucking the toes can thus cause a lot of pleasure for some women. Male erogenous zones to stimulate. In men, the erogenous zones are mainly centered on his genitals, around his penis, specifies Isabel Braun-Lestrade. Indeed, the sex of the man remains the most erogenous zone. The glans, which is the richest place in sensory sensors, is the most responsive to pleasure. The testicles and shaft of the penis, the back of the purses and the area around the anus are very excitable areas. However, other areas are also sensitive, such as the lips, neck, torso, earlobes, inner upper thighs, back, buttocks and anus, as well as the nipples and feet.